Hello to everyone from Geneva, from WHO headquarters. My name is Tariq, and I welcome you to this regular WHO press briefing on global health issues. As always, we have a number of speakers here in the room, some also online, who will be ready to answer your questions. And I will start, as always, with introducing our speakers. Dr. Tedros, WHO Director General, is with us. Also today, we are honored to have our Regional Director for Africa, Dr. Mohamed Yacoub Janabi. Welcome, Mohamed. And then we will have Dr. Abderrahman Mahamoud. He's the Director for Health Emergency Alert and Response Operations. Dr. Maria van Kerkhove is with us as well. She's the Interim Director of WHO's Department of Epidemic and Pandemic Management. Dr. Jeremy Farrar is Assistant Director General for Health Promotion and Disease Prevention and Care. Also with us is Ms. Sigrid Kranavetter, who is Director of WHO Governing Bodies. To my right is Mr. Derek Walton, WHO Legal Counsel, and also Dr. Nedret Emiroglu, Head of the Secretariat for the Intergovernmental Working Group on the WHO Pandemic Agreement. We may have a couple of colleagues also online who will be asked to answer your questions if need be. With this, I will give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. Today, I had a call with the Minister of Health of the Democratic Republic of the Congo, Minister Roger Kamba, concerning the new outbreak of Ebola disease in the country's northeastern Ituri province. Currently, WHO is aware that 13 cases of Ebola have been confirmed by INRB in Kinshasa, and on the 5th of May, WHO received a signal of suspected cases and sent a team to Ituri to support DRC health officials in their investigation of the outbreak and collect samples in the field, which initially tested negative for Ebola. Samples were subsequently sent to INRB, which yesterday confirmed some as positive for Ebola. This is the 17th recorded Ebola outbreak in DRC since the virus was first identified in 1976. DRC has a strong track record in Ebola response and control. I have also assured the Minister of our full support. The World Health Organization's representative to DRC and other WHO experts are in Ituri and working side by side with DRC health authorities to respond to and contain the outbreak. Additional WHO experts in risk communication and community engagement, infection prevention and control, clinical care and logistics will join the WHO team already on the ground in coming days. We have deployed medical supplies and protective equipment for infection prevention and control to Bunia, the Ituri provincial capital. Today, I have released $500,000 from WHO's contingency fund for emergencies to immediately support the response. Priority actions include risk communication and community engagement, strengthening disease surveillance, active case finding and contact tracing, infection prevention and control in health facilities, expanding access to safe clinical care, and increasing laboratory testing capacity. WHO will continue working to support the Democratic Republic of the Congo to bring this Ebola outbreak under control, and will deploy resources and work with and mobilize partners across the region to contain its spread and care for those affected. The outbreak is a reminder of the persistent threat to human health of disease outbreaks and the importance of cooperation and solidarity to continually strengthen global health security. The response to the Hantavirus outbreak is a recent prime example of what can happen when the world comes together to confront a disease threat. Yesterday, I wrote again to the people of Tenerife to thank them for the solidarity they showed to the passengers and crew of the MV Hondius affected by the Hantavirus outbreak. WHO worked together with approximately 30 governments, the ship's captain, crew, and passengers, the cruise ship operator, and crucially, the people of Tenerife to manage this crisis. This show of support from Tenerife will not be forgotten. Today, I hope the rest of the world is inspired by the spirit of the Tenerife and Spanish people. At a time of great division, tension, and uncertainty, we must respond jointly to common challenges that our global community faces in the spirit of cooperation. For as we at WHO always say, solidarity is the best immunity. I'm pleased to report that the operation to transfer the ship's passengers from Tenerife has been successfully completed, with more than 120 people now being cared for in their home countries or quarantined in host countries en route to their final destination. Captain Jan Dobrogowski and his 26-member crew are still on board the MV Hondius and expected to dock in the Netherlands on Monday. I remain in regular contact with Captain Jan and again salute him and his crew for their dedication to their passengers and each other. He has informed me that there are still no symptomatic persons on board as of today. WHO repeats that the risk from this event to the global population is low, and we will continue to issue updates as needed. As of today, a total of 10 cases, including 3 deaths, have been reported to WHO, including 8 people who were laboratory confirmed for Andes virus infection and 2 probable. There have been no further deaths reported since the 2nd of May. Because of the long incubation period of up to 6 weeks, more cases may be reported in coming days as passengers return to their countries where they are being quarantined and tested in specialized facilities or at home. This does not mean the outbreak is expanding. It shows that the control measures are working, that laboratory testing is ongoing, and that people are being cared for with support from their governments. It's incredible to think that it was less than 2 weeks ago, on the 2nd of May, that WHO was first notified by the United Kingdom through channels established under the international health regulations of an unknown respiratory disease on board the ship. WHO immediately convened affected countries, shared information with all member states, worked with the government in Cabo Verde, Spain, the Netherlands, and beyond to coordinate the medical evacuation of sick patients and repatriation of passengers and crew. WHO rapidly developed and shared technical guidance for the disembarkation of the people on board and their repatriation home for quarantine and follow-up. WHO continues to coordinate the global response, and our work is not finished. Our current priorities are to continue actively following up on the status of confirmed and suspected cases, to continue to better understand the epidemiology of Andes hantavirus, including how this outbreak began and spread, and to foster scientific collaboration for optimal clinical care of patients infected with this virus. In addition, we're working with more than 20 countries to coordinate studies to better understand the natural history of the disease. Today, an open scientific consultation on Andes virus medical countermeasures was convened by the UK Health Security Agency and supported by the WHO R&D blueprint to identify gaps, improve coordination, and establish priorities for research and development into potential hantavirus therapeutics and vaccines. The importance of vaccines for protecting health cannot be underestimated. New findings on the RTSS malaria vaccine generated through the WHO malaria vaccine implementation program confirm that 1 in 8 child deaths were averted among those eligible to receive the vaccine in Ghana, Kenya, and Malawi from 2019 to 2023. WHO recommended malaria vaccines are now available in 25 countries in Africa, and wider impact is expected. But funding constraints continue to limit the abilities of many countries to scale up to meet national vaccination targets. Equitable access and increased and sustained financing of immunization programs are needed to protect children and save lives. These subjects and more will likely be raised during and on the sidelines of the 79th World Health Assembly, which starts here in Geneva on Monday. I'm looking forward to welcoming all WHO member states and the global health community to join this critical event. We will come together to take stock of the state of global health and find ways to deliver on our goal of achieving the highest level of health not for some, not most, but for all people on the planet. Put simply, to achieve health for all. Thank you, and Tariq, back to you.
Thank you very much, Dr. Tedros. We will now start with our session of questions and answers, and we already have a number of journalists who are ready to do so. For all reporters, please identify yourself in your name, in your Zoom name, and then click the icon raise hand if you have a question to ask. So we will start with Agence France Presse and Nina Larsen. Nina, please come in.
Yes, hi, can you hear me?
Very well.
Yeah, thanks. Could you tell me, sorry, about the Ebola outbreak? It would be interesting to know, you mentioned 13 confirmed cases, but do you have an overview of the number of suspected cases and also deaths? And also any information about the strain that's spreading, and what level of risk you consider for the locally, regionally, and internationally. And finally, sorry, on the Hantavirus, I was just wondering if we have any idea about the third person who died, where the body is, and when we might have a confirmation that that person was also infected. Thank you.
Thank you very much. I think we will start with Dr. Mahamoud on Ebola, and then maybe Dr. Van Kerkhove can help with the second part of the question.
Thanks so much. As Dr. Tedros mentioned, Democratic Republic of Congo has wealth of experience in managing. This is the 17th outbreak they're dealing with. So as part of the surveillance, alerts are being detected and are investigated on timely. So in the same province, we had two different signals that was investigated by the team. So I don't want us to go ahead of the government. Right now they're talking. They're looking at all the data. What does the 13 confirmed is coming from a suspected case and triangulating all of the data. So we are waiting for the government to announce the details of the investigation. The report is being compiled. What was released yesterday from the lab was confirmation and the entirety of the investigation that was going on since first week of April from a different health zones. So as of now, we don't have the details what was the case definition used, who is a suspected, who's confirmed. All those information will come from the government. But well, we know very well that the country has experience, but the region where it is happening is highly volatile with the humanitarian situation going on and the population moving around from South Sudan to Uganda and other parts. So our response is to stand with the regional government, and the country neighbor in terms of solidarity to show again that they can control this outbreak. In terms of the species, INSP just had a press conference. I will refer you to that, and thank you.
Thank you very much, Abdirahman. Now maybe our regional director, Dr. Janabi, would like to add something.
Thank you, Tariq. Maybe let me just top up what Abdiv just said. DRC has got a lot of experience. If we all remember last year in August, when we had it in Bulape, which is a 5 days drive from Kinshasa, DRC has got a very strong public health services, and we went there to complement what the government is doing with other UN agencies and other non-UN agencies like CDC Africa. But I want to emphasize it's important to understand the geography this time. Ituri is 1,700 kilometers from Kinshasa. So underscoring the operational complexity of responding rapidly in such a remote and highly mobile settings. So Ituri prevent that challenging environment, and there are some security concerns which can sometimes limit some areas to be reached. Population movement is linked to mining, and cross-border trade accelerates the speed. So it's a very densely populated area, and this naturally increases the transmission rate. So we are dealing with two different environments comparing to. So at the same time, logistic constraints and the need to build that sustained community trust make the response even very urgent, needed. So I wanted to top up on that.
Thank you very much, Dr. Janabi. Maybe we go to the second part of the question with Dr. Van Kerkhove.
Yeah, thanks very much for the question. So the question was about the death, the third death reported in the Hantavirus outbreak on the ship. This was an older woman who did die on board on the 2nd of May. And indeed, there were some samples that were collected from her prior to her death that were tested in the Netherlands, and her test results came back positive. So she's one of the 3 of the confirmed cases out of the 10 in that outbreak. Her remains are on board. And as we've said before, we're working with the ship for the appropriate, proper care of her remains, and of course to get those remains back to her loved ones. So that will be something that will be in process, but I won't answer any more about that here.
Thank you very much. We have a number of raised hands, so I would really ask journalists to stick to one question. We go to start to Andrew Joseph. Andrew, please unmute yourself and go ahead.
Hi there. Thanks very much. I have a question on Ebola vaccines, please. I know the strain still needs to be confirmed, but just is there a supply of human doses of some of the experimental vaccines for whether it's Sudan or Bundibugyo, which I may have just mispronounced? And also, are there any data that the licensed vaccines offer any cross protection across strains? Thank you.
Thank you, Andrew. Ahmad?
Thank you. Yes, as you rightly saying, different Ebola strains have different. We have an approved vaccine for Ebola. We have vaccine candidate for Sudan, and we are not aware of any vaccine ready for clinical trial as WHO. We reached out through our R&D blueprint to accelerate the timeline of the availability of vaccines, research use. We have protocol ready. We worked very closely with INSP and NRP to start therapeutic and vaccine research as they become available. So our work going on, the groundwork is ready. Our R&D blueprint is working with all partners to see the availability if it is confirmed to be Bundi.
Thanks, and to supplement this, so as Abdi has said, there's a lot that's ongoing to determine the strain. So in addition to what he said of working with the R&D blueprint and the protocols, we also have vaccines that can be pre-positioned. DRC has experience with working with vaccines before, so as this outbreak unfolds, as more information becomes available, we are ready to provide those through mechanisms that already exist. Should it turn out to be a strain that can be a vaccine, where a vaccine can be used.
Thank you. Dr. Janabi, would you like to add something?
Yeah. Just to top it up, vaccine is only one of the measures. Here, I think we need to intensify surveillance, contact tracing, infection prevention and control, and safe and dignified barriers where it will be, and community engagement. So on top of vaccine, these are the things WHO is actively on the ground doing it.
Thank you, all 3 of you. The next question goes to ABC. We have Dragana Jovanovic. Dragana? can you unmute, please? Dragana, you need to unmute from your side. We may come back to you. Next is Gabrielle Emmanuel from NPR. Gabrielle?
Hi, yes, thank you so much for doing this. I wanted to better understand what the current thinking is in terms of transmission of the hantavirus and whether close prolonged contact is truly necessary, or does it seem to spread in some cases where there's not actually that close contact? Thank you.
Thank you, Gabrielle. Dr. Vankirkov.
Yeah, thanks very much for this question. So we've been getting this question a lot, and it's good to keep asking because in this situation where obviously we're learning a lot about the outbreak that's been happening on the ship, there is quite a bit of experience with hantaviruses in general, and these are typically viruses that are in rodents that spill over into humans. We do note that the Andes virus, which is responsible for this outbreak that we have on the ship, can transmit between people. There is some evidence, certainly in the outbreak that we have right now, of human-to-human transmission. I do want to remind everyone that our general risk for the global public is low. I do want to continue to put that into context, especially when we talk about different types of outbreaks and different types of viruses in this press conference. But in the current situation that we have now, we do know our working hypothesis is that the outbreak began with infection prior to the disembarkment of the ship, perhaps based on some activities of the first or the second case prior to boarding. And we do know that there might be human-to-human transmission on board, particularly between a husband and wife, between the ship's doctor and a patient. And what we're trying to do right now is look at the exposures. So from past experience, yes, the experiences around close contact where people are they're physically close to one another, might include physical contact, could be through respiratory particles. But what we want to gauge here is some uncertainty that we have. We have classified everybody that's been on the ship as a high-risk contact because we simply don't have all of the answers yet. So we are taking a precautionary approach, assuming that there might be additional cases that were on board, which is why the quarantine measures are so strict for those who have left the ship already. But I think what I want to do to answer your question is that we're learning. And when we learn more, we will update you as possible. So I could tell you what our typical experience has been. There has been another outbreak of Andes virus involving a birthday party, and there has been more casual contact where infection may have occurred. So we simply want to learn a bit more. And in the meantime, up our precautions to take a more prudent measure to stop this outbreak. So in our recommendations, we have recommended through the disembarkment and the repatriation home of the of the passengers and crew wearing respirators, again, to take that extra layer of precaution. But I think we need to learn a bit more and then report more as we learn.
Thank you, Dr. Vankirkov. Let's try one more time with Dragana from ABC. Dragana, can you now unmute yourself and ask the question? Well, it seems, okay, let's try. Dragana, can you hear us?
I do hear it. Do you hear me?
Well, there's an echo, but let's try. No, it doesn't seem working. So let's move on. Let's go to Priti Patnaik from Geneva Health Files. Priti? Just a second. We are trying to adjust. Priti, can you hear us? No. Should we go to the next one, Chris? Okay, next one in line is Hannah from Canada Press. Hannah, can you hear us?
Yes, can you hear me?
Hi, Hannah. Yes, we can hear you.
Hi, good morning. My name is Hannah Alberga from the Canadian Press. My question will touch on low-risk contacts with respect to hantavirus. So yesterday, Canada's top doctor said there were 26 cases here of who the European public health officials had classified as no risk, but Canada is deeming them as low risk. And some of these people are being advised to quarantine for 45 days. What do you make of the inconsistent assessment, given what we know from COVID about sort of guidance being inconsistent, potentially breeding mistrust?
Yep, so thanks. What I can try to provide an answer for you on is what our recommendations are. We simply, because this is an ongoing outbreak, there has been the successful repatriation of passengers and crew from the Canary Islands back to their home countries. And again, the DG has thanked Spain and the people of Canary Islands, and there's so many people to thank for that incredible operation. Because you're on a ship and people spend a lot of time together, we're looking at what those types of exposures are, and there's going to be a lot of epidemiological investigation to say this was a higher risk, this was a lower risk. But for us at WHO and for our recommendations, we've been very clear that all of the passengers and crew that were on board, we consider high risk because we simply don't know the types of contact that they had with each other prior to knowing that it was hantavirus on board. And our recommendations are for quarantine to be 42 days from the last point of exposure in a specialized facility where people are cared for or at home. And if it is done at home, to be an assessment conducted by health authorities to ensure that the person can be at home, they have a separate bathroom, they have all of the provisions that they need to not put anybody else at risk. We have the 42-day period because of the long incubation period, which means people could be incubating. They could be infected and not know it. They may not test positive. They may not develop symptoms until that last day. We do expect, there's a lot of testing that's ongoing in countries right now, and we're working with all of the countries on their protocols. And indeed, our recommendations are just that. What countries do is up to them. The policies that they set and how they follow up is up to them. We have been speaking with the countries, and what we do understand is that the contacts are in quarantine that we are aware of in all the conversations we have had. And many of the countries are deciding they'll do an assessment maybe 2 weeks from now or 3 weeks from now and decide, can that individual be safe? Do they need to stay in a specialized facility or can they go home? So again, it's a bit of a dynamic situation, but our recommendations are very clear because we know all of the people who were on board. We know the people who have left the ship in St. Helena, the people who were on board the flight from St. Helena to Johannesburg, who cared for the people in Johannesburg. And we know the denominator, if you will. We know how many people might be infected. And that's why we feel so strongly that we can, in working with governments, can really stop this. And so that's why there's so much active engagement with all of the countries right now.
Thank you so much. I will read the question that Dragana from ABC sent, and she sent it also by email. So let's try with it. And it's again for you, I think, Maria. We are hearing that a team of Argentine scientists may travel to Ushuaia next week to investigate whether hantavirus could have been present there before the Hondius departed on April 1st. Can you confirm if this is correct? Also, is WHO involved or supporting any additional field investigations linked to the outbreak?
Yeah, this is a great question. So there is an incredible collaboration scientifically and public health, not only with member states for the operation, but also to understand how this outbreak began. We are, WHO colleagues, we are working with colleagues in Argentina, in Chile, in Uruguay, and around the world, specifically with people who have experience with Andes virus, to really understand how this outbreak began. There's a lot of detail that is ongoing right now of looking at some of the exposures, particularly with the first and second cases. And I do want to emphasize for those of you who are reporting on that to really respect the privacy and the confidentiality of those two individuals who unfortunately lost their lives in this outbreak. So I just urge you to be careful about using names and identifiers. But yes, we are working with people in Argentina who are looking at the movements of those people, also looking at past hantavirus outbreaks in South America, where they occurred in humans, where there have been detection in rodents. And I certainly hope we are able, WHO is able to support further field investigations. So this is this is pure field epidemiology, linking in the lab with the sequences. And we actually hope to be able to report on that very, very soon because it's quite an active outbreak investigation ongoing that's happening right now.
Thank you. Let's move on. We still have a number of reporters with their hands up. Mike Stobe from Associated Press. Mike.
Hi, thank you for taking my question. I was wondering if you could update us a little bit on any genomic sequencing or genetic analysis of the virus to see if it's more transmissible or dangerous than the Andes virus that was identified at that birthday party in late 2018, 2019. Who's doing the genomic analysis and what has it found so far? And I guess as part of that, have any virus samples been shared with the United States, the US CDC or any institutions over here? And is it important or helpful that US labs be working on this also?
Thank you, Mike. So, Maria?
Yes. So I'm assuming you're talking about the Hantavirus. I think you said Andes in your question there, but there are quite a few labs that are working on genomic sequencing. I do want to thank NICD in South Africa, Institut Pasteur Dakar in Senegal, the Swiss at the HUG here, the university here in Geneva, for doing incredible sequencing so fast. Because if you remember, when we actually heard about this a couple of weeks ago, we weren't sure it was a hantavirus, and they NICD quickly did the diagnosis and sequencing. This work, these sequences have been shared, and they are being compared with a big group of laboratory experts who WHO has convened to work together to assess the sequence itself, to compare the current sequence with other previously shared sequences of hantaviruses in general, but also of the Andes virus. I am not a virologist, but what they are telling me is, and what they have said is that they haven't identified any changes to suggest a change in the virus to make it more transmissible, more severe, anything like that. But what we do hope actually is to have more samples coming from rodents so that we can look at the sequences within the rodents themselves, so that we could do a deeper analysis of really understanding the circulation of this virus, particularly in South America, and really disentangle and understand how circulation happens and how we can prevent spillover and outbreaks happening into the future. The US is involved in terms of US CDC working with us on this. We have a system in place where sequences, certainly we want to be shared with publicly accessible databases so that others can do analysis with those with proper attribution. We also have what the DG established called the BioHub, where we can share biological materials. And of course, we're looking to have some of those materials in the BioHub to share for research purposes as well. So there's a lot of active engagement. We at WHO will work with any researchers that are interested to work with us for the good of public health and really to understand that.
Dr. Mahmoud?
Thanks, Maria. Maria covered the most of it. But I wanted to add 2 points because the question of transmission comes up every time and it's headlines in some newspapers. We're talking about probability, the probability of transmission from an infected person to another. That depends on the virus. That was the question asked by the journalist, which is really good and answered by our virologists, how we are seeing the virus and its evolution, which we haven't seen much change. And then there are 3 factors included on that. One is the infected person, how infectious is. Like the case of the birthday party, we had someone, what was called a super spreader, how the level of infectiousness that person has is very important on that. Second is the environment that it's happening. In a crowded birthday party or in a cabin, it has an impact. And then the third element, the person being transmitted, what protection measures is taking, is person wearing PPE or not. So the interaction of the virus plus the person plus the environment and the protection will lead is the likelihood of a transmission. And then there's the likelihood of a disease happening. So I just, for those simplistic headlines, it's a big science. I will really encourage people to talk to virologists and the experts who have been dealing this. What we did, WHO, taking the precautionary principle We didn't talk about distance and how much that. We requested everybody to be quarantined at home or an institution. So you remove all the other infections. You don't tell someone to go out and keep to 2-meter distance or 1.5. We know the contacts and 450 people in the entire planet. It's easy to monitor and make sure the passengers, the crews, and people who have been in contact stay home or in a monitored quarantine. So you remove all the factors and the likelihood to achieve a zero onward transmission. Thank you.
Thank you so much, Dr. Mahmoud, for providing these points. Then we go to next question. We have a Scientific American, and we have Adam Kovac with us. Adam, can you please unmute yourself?
Hi, good morning, and thanks for taking my question. My question is about how long the infectious phase can last in the infected people who have been identified with Andes virus. Do we know how long the infectious phase will last and how long the virus can stay detectable in the body? I'm sure you might be aware there's a case study that's going around right now that indicating that the virus was still detectable in one patient 6 years after the original infection, and I'm just wondering if that's normal or if that's some kind of outlier.
Yeah, thanks very much. So actually, one of the things we're trying to do right now through our R&D blueprint is set up what we call a natural history study. There's a protocol that has been developed in collaboration with pretty incredible scientists from many different countries to look exactly at that question. So far, about 20 countries that have repatriated passengers and crew have signaled an interest to work with us on this. And essentially what this protocol will do, this study will do, is to look at serial sampling, regular sampling of individuals who are in quarantine to look at, one, are they infected, but two, are they infectious? Just because someone has an infection detected, it could be detected through serology, which might mean an indication of a past infection, but this is exactly the type of thing we would like to get a better handle on. So there is some evidence in the literature that's out there. It's very limited because while, of course, we have seen thousands of hantavirus infections. Most of those are different hantaviruses and they spill over from rodents into humans, but we've had very few clusters of Andes virus. And this outbreak, again, as tragic as it has been for the people who are directly affected, for the people who have lost their lives and their families, we also want to work with them, of course, and the governments who are caring for them to collect information to better understand. This is part of what we do here at WHO and through our R&D blueprint to be able to collect this type of information. And yes, we are aware of the study looking at positivity in semen. So part of this natural history study will actually look at this. So again, the story of this outbreak, I think will be studied for years and years. Because it is such a unique situation where we've had the entrance onto a ship, we've had an enclosed setting where people spend long periods of time together. Doesn't mean everybody has the same type of risk, but for operational purposes, we are taking the most precautions as we can. So we hope to have better answers to that as the scientists continue to work together and public health officials continue to work together.
And Dr. Mahmoud, please.
No, Maria has covered it. If the question was about the RNA detections, once someone recovers, we see RNA in the samples collected, and that can last depending on the study durations. As Maria said, there's a study going on, and we want to understand. But there's a difference between RNA detection and the infectiousness of that. It will be answered. There's a lot we don't know, and it's an evolving. This is the second large outbreak we had of Andes. But I just wanted to differentiate between RNA detections and the infectiousness of the person.
Thank you so much, Dr. Mahmoud, Dr. Van Kerkhove. I think we can go for two final questions. Priti, hopefully, is back. Priti Patnaik, Geneva Health Files. Priti.
Hi, good afternoon. Thank you for taking my question. I just wanted to know, maybe I missed it because I was not here intermittently, but under what circumstances will the IHR Emergency Committee be convened, or has it already been convened with respect to the hantavirus situation, and whether the shepherd will also be discussing the hantavirus? Thank you so much.
If we understood, the question is if and when IHR committee will convene. Who would like to take that one? Abdirahman?
I can start and then Maria can supplement. There's a process where the DG triggers IHR emergency committee. Currently, we have not reached that threshold. It's a disease we have known. Of course, there's a lot we don't know about it. And from our risk assessment, as we said, global is low. And the interventions done by the government of all the contacts, we anticipate not to call emergency committee for that. If there's a change, if there's samples collected and the person being followed, we see a new change in the virus, of course, DG will be the first person to convene. But our current understanding of the epidemiology, clinical, and environment does not show us we need an emergency committee to advise whether this is a fake or not. Yes, we've been updating the SHEPA. Last month, we gave them an update on the ongoing. Yesterday, we had our internal oversight committee. We gave them also, so all the governance bodies are informed. We've been informing our member states on the situation and what we have done so far. At this stage, we don't anticipate an emergency committee for this and this virus as it is now.
Yeah, and if I just may, so completely agree with Abdi and the assessments that we are making. And this, again, I would like to contextualize this outbreak of hantavirus. We have a situation where we have an enclosed setting now with this ship. Now, what we are trying to do is very thorough contact tracing for anyone who came in contact with this ship, particularly anybody who disembarked in St. Helena, anybody who traveled from St. Helena to South Africa, anyone who came in contact with patients in South Africa, and to really make sure that we understand how many people were potentially exposed. This is very different than COVID. It's very different than influenza. And so these critical actions that are taking place are in an effort to further contain it. Now, as we've said that these individuals have been repatriated home, they're in quarantine, there's a lot of laboratory testing that's happening right now, and the incubation period is long. We may report additional cases, but that doesn't necessarily mean that the outbreak is expanding. It actually means that the people who are in quarantine are being tested. They're being cared for. And so we need to be careful with our communication as well to explain what is happening. There's a lot of attention to this and we completely understand. The questions about transmission are spot on, and we're doing our best to answer those while explaining that we don't have all of the answers. But the outbreak is contained so far, and we and our member states and our partners are doing everything we can to ensure that that stays in place. So the risk to the general public remains low. And as Abdi has said, we will do regular updates and risk assessments. And if should something change and should the DG need to trigger the mechanisms that he has to convene an emergency committee, we will. But right now, we have a situation where everyone has cooperated incredibly, demonstrating the critical importance of the international health regulations, the critical importance of coming together to actually work together to stop this outbreak.
Thank you very much. So we'll take one last question. That's Albert Otti from DPA. Albert?
Yes, hello. Can you hear me?
Yes.
Yes, thank you. Just one short follow-up to what Dr. Tedros said at the top on hantavirus cases. He mentioned 10 reported cases as of now. In the latest disease outbreak news, there were 11 cases. Can you just briefly explain what happened to that 11th case? Thank you.
Yes, thank you very much. So in the 11 cases that we had reported in the disease outbreak news, that included one individual who had an inconclusive test, and that was someone from the United States. And since then, we've had further confirmation from the United States that that person was negative. So we've changed the case count from 11 to 10.
Thank you very much, Dr. Van Kerkhove. With this, we will conclude this press briefing. As always, we will send you a recording, audio and video recording during the evening. If you have any other questions, there were a couple of other questions that came in writing that we were not able to take, but please contact us at media@who.int with any questions you may have, and we will try to answer. And I give the floor to Dr. Tedros for his closing remarks.
Yeah, thank you, Tariq. Thank you to all members of the press for joining us today, and see you next time.